I want to welcome each one of you, the viewers of Bethan TV and the lovely viewers of the Nutrition Sport. I'm Gift Nakainga. Today it is the 30th of November, year 2023, and 30th, that means we're ending this particular month of November. So just a few hours to go, like 6 or 5 hours from now, we're going to be into December. So I would say Merry Christmas and a Happy New Year to all the viewers of the Nutrition Sport. Tonight in the studios, I'm honored to have only experts, that is Cynthia and medical doctor. I don't want today to, engeri gye tuyigira mwaka njagala abantu beeyabize eggwanga bulungi. So I'm going to start with you, Cynthia. Obadde otubuzeeko okumala ebbanga ate nga toli mugenyi wano, but I want you to welcome my viewers on the show and tell us more about you. How has it been for you? Bigenze bityo, omwaka ogumazeeko otya?
Well, hi everyone. I am Cynthia Tugonza Mugambwa and I'm a nutritionist. The year has been long. I'm happy that most of us are going to end it on a good note.
Okay.
And I'm happy to be here and share with everyone about nutrition in sickle cell disease. And I hope that everyone can pick pointers that they can share with those in their communities that are affected by it.
Thank you, Cynthia. I'll go to Dr. Mutunga. You're so much welcome.
Thank you so much.
To the viewers of the Nutrition Spot, you say hello to them.
Hello everyone, my name is Dr. Mutunga Godfrey. You can add Shadrach. I'm a medical doctor by profession. I work with Mulago National Referral Hospital. I'm a big advocate for health, community health and wellness. I also host the Wellness Project on YouTube at Dr. Mutunga TV. I'm passionate about healthcare, especially among children and adolescents. Thank you so much, Bethany TV, for having us here tonight, and I look forward to a really wonderful discussion.
Thank you so much, and to the viewers, you're so much welcome once again on the show. We're going to be handling a topic of sickle cell and nutrition. We want to see the impact of nutrition on sickle cell because we want to believe that we still have people that are suffering the condition of sickle cell. But of course, I believe that we can have proper management through what we eat. But for starters, before we go any further, I want to ask expert in the studio, why do we in the first place keep having cases of sickle cell raising?
I think I'll go first. Sickle cell is a devastating disease indeed, and it is sad that very few people know how it comes about. Right now we still have people blaming each other. For example, the husbands blaming the women if they end up with a sickler child, but there's limited genetic screening. People do not know that they carry the gene, because to have a sickler child, a career father who carries half the gene and a career mother who also carries half the gene meet, and then they get married and they give birth to a sickler child. So by all means, 100%, a sickler child carries genes from both parents. So
a sickler carries both genes?
Yes, so they pick one gene from either parent. So there is nothing like the woman is the one who brought this or the man is the one who brought this.
If you say that we're having limited genetic screening, so whom should we blame here? Tugambe nti government yetakoze, bazadde be batakoze, abagalana be batakoze, like abasawo be batakoze, ani ayina okukola ennyo mu nsonga zino?
Ndowooza kiri kufefenna.
Okay.
Yeah, it's about us, healthcare workers, but government and individuals, all of us alike, because this is something that is really deep. Every year, in the whole world, about 300,000 kids born with sickle cell disease, and 70% of those occur here in Africa. And that should tell you the burden of this disease here in Africa. But also, we have very limited knowledge about sickle cell disease in the communities. Abantu tebamanyi how sickle cell comes about. Abamu bakyalowooza nti bwandibanga bulwadde bwa spiritual warfare, nti oba bamuloga, oba bankasinga, oba bakola ki. So it becomes a challenge to beat something like that, which has been deeply connected with spirituality and all.
Because,
so,
okay, maybe
So to me, I think the problem is to do with limited knowledge.
It's the huge problem that we have.
Yeah.
People don't have enough knowledge
People
on the
do not know,
condition.
because for all the times, I will go with myself. For all the times I have known better, I have acted better on things in life. Like the more I seek knowledge on things, concepts, ideas, the more I get enlightened, the better choices I make. So if the community can get knowledge about sickle cell disease, leave alone the English that we speak here, na ye in our different local languages, we tugera ne tunyonyola bana Uganda on the grassroots, sickle cell ajatya, then baja kubeera better informed to make better choices. Omutagamente bwemba sinaba getting married to the love of my life, kansooke nkoleye ne test neno okulaba oba muntu wange ali bulungi oba tali bulungi, ndyoke ngambe nti I do, ndyoke ngende naye for marriage and all.
Thank you so much. Today I had a discussion with one of the doctors and I was asking him why do we still have these cases rising each and every day. And he gave an example of a couple that they approached him before they got engaged together, and then he told them you cannot, continue having children. So they insisted on having children. Nebafuna omwana asooka nga is a sickler, the very first child. So this doctor told them, you should stop. Muchikomye, you should separate. It's a hard pill, eh? Yeah, so he told them you should separate because this is not good for the both of you, not even for the both of the children that you will have. So they were like, no, tusobola okukozesa herbs, tusobola okuteminga, like we can have treatment before, and then maybe abana betunadako okufuna bajja kuba nga si balwadde. So they got pregnant again, another child, and for this child they did the test and it was 90%. So for him, he was more sick than even the first child. So I'm thinking that in the society we're having many people like that, like he's mentioned, the knowledge is not yet out there about what causes sickle cell. But to those that are already diagnosed, to those that have surfaced with the condition, to you, Cynthia, what do you think nutrition can do to help them live a longer and healthier life?
All right. Well, that's quite broad, but I'll try.
We shall break
it down. I think one of the fundamental importances of nutrition in sickle cell disease is that it helps to alleviate the complications that come with the condition. If we go back to how do I say this in layman terms, to the way sickle cell happens in the body, like what happens, what we call the pathophysiology. We have the sickle cell red blood cells that break down. They break down faster than the normal red blood cells. So when we focus on nutrition, one of the nutrients we focus on, some of the key nutrients we focus on are folate and zinc. And these are the nutrients that help us help our bodies to make red blood cells, and also maintain the cell function and the growth as well. So this is one of the ways that nutrition plays a key aspect in making sure that, if someone has sickle cell, at least their body will try to regenerate blood cells faster if we are focusing on those key nutrients.
Thank you so much, Cynthia. Ati Dr. Mtonga, bwe tugamba nti abantu ba sickle cell, okay, that we've not taken trouble to do the genetic screening, but we've looked at conditions like malaria, and then we see that they manifest in a particular way. Someone will maybe feel a headache, a fever, and something. So to people that are having children, and they do not know whether they have sickle cell or not because they never did the test, what are some of the symptoms or the manifestations that they can look out for to maybe rush to test for this particular condition?
For starters, sickle cell disease may not manifest immediately at birth. So it takes a while for symptoms to set in because children are born with that fetal hemoglobin. Hemoglobin is the molecule in our blood that carries oxygen around the body to various tissues. So the fetal hemoglobin is sort of protective, and so symptoms will not show up until like 6 months after birth of the baby. So after like 6 to 7 months, when the fetal hemoglobin that the child was born with has dwindled, and now sickle hemoglobin is now accumulating and taking shape, then you start now having issues to do with sickle hemoglobin. Red blood cells that have that hemoglobin molecule, known as sickle hemoglobin, keep crashing, and they don't. Normal red blood cells are supposed to fold when they reach a certain part of the blood vessels, especially the small vessels. They're supposed to change shape and be able to pass through. But with the sickle hemoglobin, they don't have the ability to change shape in case they reach the capillaries, for example, where the thickness of the blood vessels is really small. So what happens is symptoms start setting in, like painful crisis, as red blood cells crash in those small parts of the blood vessels. And so you're going to have like swelling of the hands and the feet, and the babies will cry a lot because of that accumulation and crushing of the red blood cells in the end parts of the hands, especially fingers, and also the toes. And that causes one of the presentations of sickle cell disease, known as vaso-occlusive crisis, because the sickle hemoglobin red blood cells keep crashing and occluding. But also, because if you're having a blockage in the blood vessels, it means there is no free exchange of oxygen and carbon dioxide and all those other nutrients. So if blood flow is cut off to some parts of the body, you can also have oxygen being deprived, not reaching those parts of the body, and then there's intense pain. Yeah, and when that goes on and on, you could also have death of the tissues due to lack of enough oxygen. So one of the commonest presentations will be painful crisis, but also later on they may have swelling of the spleen, because there is increased destruction of sickle red blood cells. So the spleen does that, and so there can be destruction and also pooling of blood, and then the spleen will accumulate all those and become big. So when you try to like check their abdomen, you could find a child with a massive spleen. Yeah, the other thing you could see is because there is increased breakdown of red blood cells and hemoglobin is being broken, you could also see that the child will have yellow eyes, like jaundice, because bilirubin, which is coming from the destruction of the red blood cells, is released now into the bloodstream, and so it will find itself into the mucous membranes, like of the eyes. So if you check the child's eyes, they will be deeply yellow. Yeah.
Okay.
Yes.
So to our viewers, we're looking at nutrition in sickle cell. Twagala okulaba ngeri ki gye kiyinza okuyamba bannaffe abalina obulwadde buno mu kuyita mu kulya nga tetutunuulidde eddagala, tetutunuulidde any other treatment modalities, but through the normal things that they can easily access maybe from home. So we have our nutritionist as Cynthia. Ogenda kutubuulira mu kutandika watugambye nti waliwo ebirungo ebyenjawulo omubiri gwe biba byetaaga, omuli folate n'ebirala. So maybe you break it down for us to understand byakulya ki omuntu by'alina okulya, kuba ffe ogamba folate tetujja kugenda mu madduka tuno. So we want to get to know those particular foods that twetaaga nti bwe ndya ennyaanya it will help. So yeah.
Okay. Before we get into the foods, I'll again highlight the key nutrients that we need. Of course, folate and zinc top the list because these are the ones that help to make red blood cells in the body, which is what we want. We want the body to form new red blood cells because the sickle cell shaped blood cells break down faster. But also you'll find that in many sickle cell patients, if you most of us know how they present. They're usually, most of them are smaller than they should be. You most likely not find a sickle cell patient who is like fat. So we also need to have enough calories and protein. Calories because the body is in constant inflammation, so their metabolism is higher than the normal person. So for calories, we'll find that a patient who has sickle cell disease needs to eat more carbohydrates than me, because their body is metabolizing faster. And for carbohydrates, we have our everyday food. We have matoke, we have rice, we have pumpkins, we have yams. But even as they are having this, it means that they need to have them in more quantities than, let's say, me or Dr. Shadrach or you gift. We also need to have more protein, because usually they have, you find that they have lower skeletal mass than the normal person. So they, need to build their bones and also muscle as well. So protein also, we have two types of protein. We have animal protein, we have plant protein, we have beans, peas, we have meat, chicken, fish. Fish is an excellent source of protein. So I would definitely encourage anyone out there who is suffering from sickle cell disease to have plenty of it. It's one of the most excellent sources of protein. Then we have folate, which is very important, like I said before, in the generation of new red blood cells. So with folate, it's the foods that are high in folate. We have liver. However, with liver, we have to be very cautious in how we consume it, because liver is also high in iron. And in most cases, you find that children or people who have sickle cell disease undergo blood transfusions more often. So this can cause iron overload, which is also not good for the body. So when it comes to this, it's a bit tricky, because as a nutritionist, I would have to see what is your iron level in the body. Okay. However, so with liver, we go a bit low, but sorry, we have to be very cautious. Okay. So foods that are high in folate, we have spinach, which is in our markets. We have broccoli. It can be a bit pricey, but it's an excellent source. We have beans. We have peanuts. Those are the top sources of folate. Spinach is very good. You'll find it at 1,500 in the market. We also have zinc. Like I said, also zinc is very important for the generation of new red blood cells, for immunity, and many other things in the body. So with zinc, one of the everyday foods that we eat that is an excellent source is pumpkin. Be it the pumpkin or the pumpkin seeds, you're going to get, you're going to get the zinc that you need. We also find it in our everyday foods like milk, meat, chicken, poultry. It's also in the beans as well. But however, with zinc, you find that as much as it's in our everyday food, because most of, let's say, like beans have a compound called phytates. So phytates inhibit the absorption of zinc. So you're better off getting it from pumpkin, or oftentimes it's better to just get a supplement from a pharmacy in the recommended amounts. Yes.
So you should say that every child or every individual that is having sickle cell should be attached to a nutritionist, because it's not a matter of going to and you just consume the beans, consume the carbohydrates without knowing the quantities. Yes. Thank you so much, Cynthia. I think at this point of time, we're just going to get into a break, and then we shall come back to continue with our discussion on the importance of nutrition in managing sickle cell disease. It is the Nutrition Spot. It's been mentioned that sickle cell disease is one of those genetic blood disorders that affect the shape of the red blood cells, and it's a deadly disease that you would not want to surface within your lifetime. It comes with a lot of complications that they are manageable, but they have a very huge, not good impact on your life. So it is important, if you can avoid, you avoid it. But if it so happens that you've been already exposed, you've been already diagnosed, there is a way to managing the symptoms, managing the complications that our doctor mentioned about the organ damage, the pain and everything that comes with the condition, and also the psychological torture. But it's very important that you attach yourself to maybe the experts, the nutritionists, the counselors, the medical doctors. Have a team of people that are managing you or that are managing your child. So we're going to still dive deep into knowing what is the impact of nutrition on sickle cells. So our nutritionist mentioned about the foods that we should be able to eat to help us manage the symptoms, but we believe there are also foods that can trigger the symptoms of the disease. So I want to go back to Cynthia to make us understand. You've talked about the carbohydrates, proteins, the zinc, and all those other foods that can help us manage. But are there foods that can trigger, just like it is in menstruation? Someone will tell you, if I take beans, I bleed a lot, I do this. So does it happen in sickle cell?
Yes, definitely. One of the first, should I say it's a food, alcohol? Yeah. Because alcohol actually, it fastens iron absorption in the body, and we really don't want an iron overload. So it's one of those things that people who have sickle cell should take in very little quantities, I would say. We also have foods that are high in sodium. Foods that are high in sodium usually are refined foods, things like sausages. Also, most of the foods that we buy from supermarkets, they are really high in sodium. When you look at the crispy,
so why should them avoid the sodium?
Because sodium causes water retention, yes, and yet we want free flowing, want your blood to move freely, because already there is the sickle cell. The sickle cells block the small capillaries, like Dr. Shadrack had said. So we have to watch out for foods that are high in sodium. Also, they need to watch on their salt intake. How much salt are you taking in your daily food? I think other foods another type of food I would say sickle cell patients should watch out for is liver, because it's a very high source of iron. When it comes to iron, really it's a case-by-case basis. So we need to assess and see where your iron levels.
So it's per individual?
Yeah, it's per individual. Okay. Because the thing is, most people mistake sickle cell anemia for the normal anemia that other people have, and yet they are two complete things.
Maybe doctor can help us differentiate that too.
Yes.
Sickle cell anemia is you have low hemoglobin, but it's due to increased breakdown. But you could have anemia, which is low hemoglobin levels coming from reduced intake, maybe lacking iron in the body, lacking vitamin B12 and folic acid. So you could have anemia due to another chronic illness, but not sickle cell. There you might even need iron supplementation, for example. But for sickle cell disease, you actually have enough iron. It's just there is increased breakdown of your red blood cells. So it's a cause from over breakdown and not iron lacking. Yes. So some people tend to think, for anemia we do this, and so they think it's a one-size-fits-all approach when it comes to management of sickle cell anemia, but the cause is different, and so it's the management. I also wanted to say something about what Cynthia said about sodium. The last thing you want if you have sickle cell disease is an increase in blood pressure. And eating a lot of salt is associated with high blood pressure, and so they are already prone to things like strokes. And so if you have high blood pressure, that elevates the risk. But I also want to talk about hydration, water. If you have sickle cell disease, it's only advisable that you drink a lot. Ensure that you hydrate yourself actually more than you eat. Because if you take in enough fluids, your vessels dilate, and then the sickle-shaped red blood cells are able to swim freely through large-sized blood vessels. But if you're not drinking enough and you end up with dehydration, and then you now have these cells crashing because the blood vessels shrink. But also avoid eating things which are icy. Yes,
Icy?
icy stuff
Yeah.
like ice water, iced yogurts, iced drinks, iced foods. Because
You
these
can break down the ice. I want
yes,
my viewer that is in way to understand.
by iced ndimu kutegeeza ebintu ebinyogoga nga ice cream oyo nga yogurts abadde mu fridge nga nyogoga ennyo because eating cold things causing blood vessels to narrow, to constrict, and so when blood vessels constrict, they already breaking the already sickle-shaped red blood cells will not be able to pass freely because now your blood vessels have shrunk.
Yeah.
So you're advised to drink warm things such that your blood vessels can remain open to allow free passage, because the more these blood vessels, red blood cells, pass through the blood vessels without challenges, the better for you. Meaning, if you superhydrate yourself, we normally give them oral rehydration salts, or that's just a brand of some of those, and so they drink a lot of it, like maybe 1 to 2 circuits every day, and that has been associated with less crises. Tebatera nnyo kufuna that vasal occlusion. But if you're someone who is immersing yourself in lots of activities and you're not drinking enough, you're at high risk of developing
complications.
Yes.
So if of course you've talked about the hydration, but I know you've said it's really very important and key. We've also talked about the diet, that it's very important. Talk about the exercise.
Yeah, definitely exercise is good. Exercise is good in every situation because exercise helps us to feel good. Yeah, you want to have moments when you forget about your chronic diagnosis and just get to live, to reconnect with life. And so exercise is very vital, because on the days when you don't have a crisis and you're doing perfectly okay, play around, sweat, even that causes dilation of the blood vessels, by the way. The sweating and all.
Maybe a minute as we work on your sound. Let me go to Cynthia to he's been emphasizing the bit of the exercise, but do we have our specific precautions or activities that we should avoid? For example, you see someone that is really grown up, but they've survived all the the complications. Then they're 40s or 30s or 50s. Is there particular things they should avoid doing that can also trigger the symptoms?
Okay. So one of the things I would say, as a sickle cell patient, of course, like Dr. Shadrack has said, exercise is good for you, you feel good, but also exercise. Wait, is this in relation to exercise or just generally?
It's in general.
In general. Well, you find people who have lived that long are taking good care of themselves. They are paying attention to their diet. Most of these people actually do regular checkups. They come and check, how is my blood count doing, where are my hemoglobin levels, they hydrate. So it's very, very important to pay attention to what you're eating. They're not, most of these people don't even take alcohol. So you find that these people have spoken to a nutritionist, they've spoken to a doctor, so the management is it's complete. But also, the thing is, nutritionists are just not here. We have nutritionists right now in almost all regional referral hospitals. We have a nutritionist. I think also Dr. Shadrack can talk about, I know they use hydroxyurea, which is a drug that helps keep their, it helps to regenerate blood cells, if I'm not mistaken. But also it also helps in prevent the crises that are happening. So of course, the less time you spend in hospital, because most times if you're in hospital, most people end up developing other complications. You find they have hospital acquired infection. So you really want to reduce the time spent in hospital. So pay attention to your diet, take your drugs on time. We also want to pay attention to our immune system, because usually these people have a reduced white blood cell count, which is what helps us fight off infections. So you really want to eat enough fruits and vegetables. So does
that put us to, now I can call it, I think usually we believe that these people have a low immunity, like we would want to categorize them under the low immunocompromised, yes, suppression. So are they under there? So if they are, besides them not frequenting the hospital for admissions and all that, what are those other things you can really emphasize for someone to do, and maybe on a regular, maybe you can say it could be the exercise. Some people are not, they're not faithful.
Yeah.
But yeah, which other things? And also you should also think of a setting, of a family setting, but they have this kind of person.
Okay, I think before I answer, let me ask Dr. Shadrach to talk about, you talked about, you gave us a scenario at the beginning whereby this couple, their second child was, is it sicker, more sick than the first one? So maybe you can first help us break it down, then I can.
Okay, sickle cell disease affects hemoglobin synthesis, but it runs on a continuum. You can have someone who has hemoglobin A, which is normal, and hemoglobin S, but with a percentage of like 30%. Another one will have 50%. Another one will have 90%. Those people will not be affected the same way. So someone who has like 90% of hemoglobin S, which is the sickle hemoglobin, gets frequent attacks. And
this other second kid had 90% of HBS.
That means that they are really prone to frequent crises and they need more urgent care. We have people who have sickle cells who attend a sickle cell clinic at our Mulago sickle cell clinic, and they will tell you, in a year I've had only one crisis or none sometimes, but it depends on a lot of factors. Yes, we have the percentage of the sickle hemoglobin that the person has, but it also depends on the overall care that the person is receiving. So you have those routine medications, the folic acid, which is the folate. It helps with regeneration of the red blood cells because they're breaking down at a really fast rate. And then we also have the hydroxyurea, which is helping to reduce the crisis. We also give them some antibiotics to help cover them against encapsulated organisms. And then we can also provide a vaccine because they are prone to getting infections, especially encapsulated gram-positives. So we give them vaccines, but it also depends in which setting. Some countries are better at managing sickle cell disease than others because of
let's
differences.
Talk about Uganda.
Yeah, differences in finance. So in Uganda, for example, I'll talk about the hydroxyurea. We get out of stock reports quite often because hydroxyurea is a quite expensive drug, and most of it is actually donated by Samaritans across. So we have lots of people living with sickle cell disease in this country. So sometimes patients come and it's out of stock. And so they have to buy it, and considering financial burden, some parents don't afford, and that affects the overall health of the person. And I think I want to talk about when it comes to nutrition is alcohol. She talked about alcohol. Alcohol causes dehydration, and when you end up with dehydration, then you have vessels constricting, then you're at risk of getting a crisis from your vessels constricting. So avoid alcohol, avoid energy drinks, they also cause dehydration. Avoid coffee. Avoid avoid
why coffee?
Coffee also has caffeine. Caffeine also causes dehydration. Same thing to energy drinks, Sting, Power Play, Bull, and all. They also cause dehydration, and dehydration predisposes one to vasoconstriction. So they're going to end up with painful crisis because of lack of enough water.
I wanted to ask, actually, I think we would have explained that earlier. Bogamba crisis, I think we keep using that one. Crisis and crisis.
Crisis, it's like, obancho gentia mu Luganda. Simanyi bulungi Oluganda, but njagezaako crisis kangambe nti okulumbibwa with episodes of ekirwadde ky'obuyina oba obulumi, okuzimba engalo, kale okubeera very sick because of the condition. Bayina abana ababeera ne sickle cell disease, it's not like every day they are crying and all. Bayina moments of relief, moments of actually fulfilling life, and then maybe due to rain and coldness, maybe due to another infection like malaria and all, dehydration and all, they now get exacerbations. Exacerbations are like symptoms now set in, but when they are severe. And so I would characterize all that moment as a crisis. Yes.
Thank you so much. Before we go to Cynthia, there is something I want to really ask.
Yes, please.
I started saying that what is failing in our country and even worldwide? Why do we still have cases and yet we know it is genetical? Tell us about the prognosis of sickle cell disease.
Sickle cell disease is not a friendly disease, I should say. Actually, just last week we lost a colleague of ours to sickle cell disease, and it still pains me to this moment. Yeah, it's not friendly because you have no idea when you'll go, and sometimes someone gets anemia and there's no blood, and they succumb to the anemia. So it's not a nice disease to have, if I should say, but it is preventable if you do screening. But how many people know that we have to screen? So we need to package these beautiful messages that we're sharing here right now to the grassroots, to people in Ibududa, people in Gulu, people in down there in Ibufumbira, to know that there is this disease and it's carried on genes, and it's not because of gods are not happy with your marriage or because you annoyed your pastor or anything. It's actually due to obutofali bwetusitula in our genetics, in our genes. And buli omu omukyala aleeta akatundu ne taata naye naleeta akatundu, ne babeera nga bafunye omwana alina sickle cell disease. Ekitegeeza nti bwe tugenda ne batukebera, temukebera sirimu yeka, mukebereko ne sickle cell disease, mulabe amaye career, because omuntu ali career alabika nga nze bwe nti taina sign yona elaga nti ono omuntu ali carrier of sickle cell disease. So they live very fulfilling lives until one career meets another career, nga bali perfectly healthy, perfectly normal by looks, ne bazaala omwana nga alina sickle cell disease because they contribute to the gene unknowingly.
Actually, just to chip in on that, I think it's upon all of us, because you'll find even us in our normal, it's not until it happens in your family, it's not something rather that someone thinks so. All we think of when people are getting married is HIV. You'll find that even in church, when people are getting married, they'll want to test them for HIV.
Only.
Yes, but we really, like at every point of let's say like a couple, the people that are involved need to really be proactive in getting them to screen for this disease.
Thank you so much. So I'd ask you a question besides the exercise, the diet. What is it that we can do? If you are watching the Nutrition Spot, we're talking of the importance of nutrition in sickle cell. You can watch us on our website, www.bethanTV.ug, or you can go on Facebook or YouTube. If you have any questions that even when we are winding up with the show, you can leave your questions there. We shall make you get in touch with the experts, with a nutritionist, with a doctor, to help you walk this journey. So back to you, Cynthia.
Yes. I think management is really in nutrition, and your frequent medical visits to the hospital. But I think the best I can do right now is give an example of, let's say, how would one eat if they have sickle cell disease. I'm going to give like the average home example. I think people who have kids or people who are affected by sickle cell in their homes.
Let me first have this one caller, then you can start from there.
No
Hello. Hello. Okay, if you are trying to call, kindly call, because we're just about to wind up with the show. But if you're unable to go through, you can put your questions on our different social medias or on our WhatsApp. We shall be able to read them. Back to you, Cynthia.
Oh yes, I was trying to give an example of what nutrition can look like in a normal average setting. I think families should stock. There are, I think, affordable foods that we can really utilize. We have millet porridge. We have eggs, are a good source of zinc. So this person who has sickle cell disease should be having more than the normal, in a normal person would be worried about obesity and all these things, but this person should eat more because their dairy intake is ordinarily, actually these people eat less than the normal average person because they usually have abdominal pain,
anorexia.
Yes, anorexia, they're usually anorexic. So another thing is that we need to increase on their fruit intake. Fruits and vegetables are one of those things that help with appetite.
Yeah.
So let's say if you've woken up, you've had your millet porridge, maybe 1.5 cups, you've had your eggs, you've had some bread, maybe 1 slice of bread in the middle of your breakfast and lunch. You can have, let's say, mangoes. Yeah.
Let me have
Hello.
this one. Caller.
Okay.
Hello.
Hello.
Hello, you are watching Bethlehem TV and this is the Nutrition Spot. Your question on nutrition in sickle cell.
Yeah, this is Teacher Calvin.
Can you speak a bit louder? Yogera konyo osobola okuwulira.
Hello. Hello.
Hello.
Yes, my question is.
Okay.
Okay. Looks like our caller is not going through. But okay, ordinarily, this person should have 5 meals, I would say.
5 meals in a day.
5 meals with 2 being snacks. So
just there.
I
really want us to be very practical.
yeah.
We have different kinds of categories of people in Uganda. There are those that can manage the 5 meals, the 2 meals, the how many meals. So, but let us look at people that are in, I don't know which kind of setting. So if you say 5 meals, I feel like
It's unrealistic. Actually, when I break it down, you get to see where I'm coming from.
Now let's do the breakdown.
Okay, let's say, when I say 5 meals, the 3 meals usually take a breakfast, lunch, supper, which most homes, I would say, most homes have breakfast, lunch, supper. Or you find in other homes, they actually eat late lunch, which also doubles as supper. But those 2 extra meals, this patient should be able to at least have some fruits in between there. You understand? So with fruits, usually, if we are to get practical, I usually tell people, get what is in season. Yeah. You'll find mangoes are in season, you buy those ones. Yeah. You find pineapples are in season,
you get the
you get pineapples. There is avocado, which is like 500, get that. So the thing is, in our culture setting here, nutrition is often underlooked. But if you're intentional about it, it's actually very, very, very practical. If you come from a home whereby, let's say you have late lunch, which doubles as your dinner as well, that is fine. You can have an extra cup of porridge, let's say at 8. Let's say porridge and probably some bread. Your dinner is done. So, but with nutrition, really, it's case by case basis. The nutritionist will have to see your...
Don't worry, they will look for you. Yes, Dr. Sadra, just in less than a minute.
I think to add on what she's saying, in sickle cell disease, we have so many things breaking down. You're in pain. Then also people with sickle cell disease have a higher metabolic rate. Like things are breaking down really quickly. That's why they end up wasted. They don't. Some of them don't even mature early enough, like reaching sexual maturity or bones fusing, because of reduced intake. Because you're always in pain, you're having this crisis. You don't have the appetite to eat enough to grow up as other people in the communities. So what she's trying to say is we need to encourage people with sickle cell disease to eat as much as they can, because it's rare that they eat enough.
And so they should eat.
And not eating enough actually causes poor clinical outcomes. Yeah. We are going to have them on our nutrition unit because of micronutrient deficiencies or even protein energy malnutrition, because they're not eating enough. And sometimes they have crises oba obulumbaganyi mu bulubuto, which can affect their absorption or nebabanga tebayingiza ebibirisa in a good way. And so that can cause them to miss out on some essential nutrients. So depending on family, if you can afford, I would also recommend them to have like some omega-3 supplements, fish oils, if you can buy like sardines or salmons. If you can afford, they can buy those. But if you can't, you can just buy omega-3 supplements.
Thank you so much. I think it's about time that we get done with this show. I want to appreciate you, our dear viewers, and I want to appreciate you, our guests. I thank you so much for coming through and for passing on that knowledge. Till next Thursday, do not forget the Nutrition Spot from 8 to 9.